All right, welcome everybody. This is Advantage Medical Testing. This is Christian. We're going to go ahead and get through the initial webinar training. Again, at the end of the recording, we'll go ahead and take questions. So write them down if you have them in between. And for some of you, I apologize if this is a review, but we've recently signed up with a new lab to take care of our PGX and CGX tests. We'll get to that in just a second. All right. So here's what's going to happen today. We're going to talk about the company structure. We're going to go over Medicare and Medicaid, a little bit of a tour of the website, how to pre-qualify patients, how to qualify patients, required paperwork, how to collect the samples, how to handle the samples, how to ship the samples, and label the samples. We're also going to be going over what I think is pretty important, how to get paid. Here's a little bit of an overview of the company structure. We've got essentially two sides of Advantage Medical Testing. We've got a no-cost side and a retail side. You can make money in both sides. All right, so everybody on the call here, when you signed up, had committed to doing 3 combo tests a week with our lab, and that is a PGX and CGX is considered to be a combo. Here's the overview. So we have a state or territory manager, and then we have the technicians, and the no-cost side is a flat rate based on the test. Okay. The retail side, again, state territory managers, genetic testing technicians, and this is based on a percentage of the retail pricing. Insurance-funded testing, no cost. As of today, August 12, 2019, we are offering 2 no-cost tests. This will be changing in the next 2 weeks, but for today, the 2 that we're going to talk about are number 1, the PGX, and number 2, the CGX. Coming soon, relaunching the cardio, Alzheimer's, Parkinson's, dementia test, and the Beacon Carrier test for the Medicaid states. Also for Medicare will be respiratory and allergy. So to pre-qualify for these programs, a patient has to have Medicare B or Medicare Advantage, PPO, and ignore this Humana HMO thing. Okay, that's an error right now. Medicare Part B. So the people have to be 65 to 79 to qualify for this program with this lab. Okay, Medicaid is approved in certain states. We'll give you a list. Before we get into it too much, we got to talk about Medicare fraud. We have a zero tolerance here at AMT for Medicare fraud. Number 1, fraud is illegal. And it doesn't matter if you complete the fraud, it matters if you try to attempt the fraud. What are some examples of Medicare fraud? Well, go online and look at the horror stories. Okay, just know this. Medicare, Medicaid fraud, we have a zero tolerance. HIPAA, everybody on the call should have already completed their HIPAA certification. Even though it's only an hour, hour and a half online class, it's very important to understand that even though the test or the quiz is very repetitive in nature and the training was very repetitive in nature, bottom line, HIPAA means patient privacy. So we do not want to violate HIPAA rules. One of the ways we're going to make sure we don't violate HIPAA rules is during our events or public outings, we will not be doing any swabbing, period, at a public event for the no-cost program. These are what the 2 Medicare cards look like. You got the older style. You can see it on the left, and the newer style on the right. Patients will need to have these when you do the testing. Medicaid states, as of August 2019, these are the states where we can do these no-cost tests in, are Colorado, Georgia, Louisiana, Maryland, and Tennessee. Now, those of you in a Medicaid state that's listed, there'll be additional training and different procedures to run a Medicaid test. A couple of key terms here. Swabbing. That's using a certified sterile device to collect a DNA sample from the client. And quality control. This is where everything gets checked out before it's actually processed. One of the things that may come up as a question is, are your tests FDA certified or FDA approved? Here's a spoiler. There are no tests that are FDA approved out there, not a single one. Ours are not FDA approved either. But we do have an FDA approval, and I'm going to explain that. We do qualify for the FDA approved criteria, and here's how it works. FDA approval applies to the device where you collect the specimen or the DNA and the methodology behind running the tests. So even though I said our tests are not FDA approved, our tests are essentially FDA approved if we use a FDA approved collection device and a FDA approved methodology. All right, let's go over some more terms. Doctor. Seems simple enough. A doctor, right? Well, a doctor in this sense is the physician that evaluates the submitted form or application, signs off, and may prescribe medicine based on the results. This may not be the patient's primary physician. However, the primary care physician is oftentimes contacted to sign off on these tests. QC, lab, it's companies that all swabs are sent to and performs all testing directed by the doctor. Ascension, this is an important term. When the samples go to the lab, they're first tested to see whether there is enough viable DNA that is not contaminated to perform the test. Ascension will come up later. All right. Let's start off with one of the first two tests that we're going to talk about, the PGX test. PGX stands for pharmacogenomics, and pharmacogenomics is a study of how genes affect a person's response to drugs. It's a relatively new field, and it combines pharmacology and genomics, and basically place people in one of four categories. We'll talk about that. PGX test, it's a genetic test to predict a patient's likelihood to experience an adverse event or not respond to a given drug. Step back. People will fall into different categories when it comes to medication. We've got different categories that they fall into pertaining to whether or not they absorb the drugs too rapidly, whether or not they absorb them too slowly. Okay, because people will not absorb medications equally. CGX test, this is the cancer genomic test. And this is for likelihood that the person you're swabbing will get a hereditary cancer. It's not a test to tell you whether or not you have cancer. None of our tests are diagnostic pertaining to the DNA testing. We do have some blood tests and urine tests that are available for diagnostic. That'll be in a different module. So cancer genomics, the CGX test, will let someone know their likelihood to receive a hereditary cancer or pass it down to the following generations. All right. A couple of key terms here. Personal history and family history. It seems silly, but we have to talk about it. A personal history is when the patient that you're swabbing actually has a personal experience with cancer. So they have either had a cancer or have a cancer currently. Family history, we look at 3 degrees: first-degree blood relatives, second-degree blood relatives, and third-degree blood relatives. First degree would be a parent, a sibling, or a child. That is a first-degree relationship. A second degree would be a grandparent, a grandchild, an uncle, an aunt, a niece, nephew, etc., and a half-brother or sister. A third degree, great-grandparent, great-grandchild, uncle, aunt, cousin, again, great. So why is it important for a 75-year-old person to get a CGX test? Well, if they find out that in the next 10 years they have the likelihood of getting brain cancer, they probably do not have a personal concern, but they do or should have a concern for their children and grandchildren and great-grandchildren. So we're going to go into these 2 tests here and how to qualify them. We'll start with the PGX. A patient must be taking prescribed medicines. And we have to list all the medicines and what they're used for. And the patient must be on medications for either a blood heart, which would be cholesterol, high blood pressure, etc. That's one category, blood heart. Second category is pain, and it must be a chronic pain med. Not someone that tripped and broke their arm, got some oxys for 3 days. This has to be a chronic pain condition. Okay? And the pain, like it must be a long-term medication. The third category is psychological, and that's like Xanax, Seroquel, Adderall, etc. This is for like mental issues, including depression and anxiety. So they must have 2 or more prescribed medications in one of the 3. It's mix and match. Okay? They have to have at least 2 current prescriptions. How to qualify for a CGX? Now we have something down here at the bottom you've already read ahead, family history of 3 or personal history. Well, they're not going to typically turn away an applicant if they either have a personal history or a family history of at least 2 people. They're approving these tests, but we shoot for 3. If we can't get 3, but we can get 2, that's okay. So we can accept a personal history of cancer and or a family history of cancer for cancers that are not environmental. So pretty much every cancer except lung cancer, because that can be prevented, has nothing to do with the DNA. Skin cancer, there's an exception to that, we'll talk about it. Lymphoma and leukemia. Now, gender-specific cancers, for example, this is pertaining to a family history. If you're a male taking this test and the only cancer that you have to qualify for are like females in your family having ovarian cancer, well, pardon me, men do not have ovaries. So they're saying that gender-only cancers do not qualify. However, I can tell you this, if you're sitting with somebody that has 2 or 3 family members that have a history of a gender-opposite only cancer, I want you to submit that application. They have about 8 out of 10 chance of getting approved. So here's a sample or an example of some qualifying cancers: breast, ovarian, colorectal, pancreatic, prostate, and there's many more cancers that are non-environmental. Cancers that help build a case for the cancer qualification and approval: bladder, testicular, spleen, liver, fallopian tube. Melanoma. A melanoma is a form of skin cancer, but it's life-threatening. So if somebody has a melanoma, we're going to submit this application because they're likely to get approved. Thyroid, brain, kidney, and stomach. Cancers that don't qualify. Even though in our application you'll list all the cancers for all the family members you can come up with, even if they're a non-qualifying cancer, we still want to list them. But here are a few. If they have only a personal or family history of these, may not get approved. Environmental cancers, okay? Lung cancer is contracted by being exposed to toxins. So they believe, or they figure, that lung cancer can be prevented. Even though you don't have a choice to not be exposed, lung cancer can be prevented. Skin cancer, which is exposure to the sun a lot of times. So basal cell and squamous cell carcinomas, they are usually disqualifiers. However, we still want you to list these even if they have them. Okay? Lymphoma, lung, and leukemia, again, are all considered to be environmental cancers, but we will still list them on the application. Medicare Part A and Part B, that's what we look at. Okay, and again, here's a sample of what those cards appear to look like. There are two different types of Medicare and Medicare coverages. There's a PPO, which means that people on Medicare can go see any doctor they want, and there's an HMO, which means that people can only go to a specific network. Okay, as of now, today, August 12, 2019, we are doing only PPOs. Okay, we're going to show you how to qualify these people and verify their coverage. But what I want you to look at on this screen is over here, Part A, a date, Part B, a date, and a Medicare number. Okay, these are going to be important. HMO means no. Now, in the past, we've had to go to Medicare.gov and to verify their coverages by just putting in their name, address, and that kind of a thing, and the Medicare number, it would pop up that it was an HMO or PPO. It was very confusing for some, however, so we have a new way to verify patient coverages. Again, HMO, it's a network. PPO is out of network, which means that they'll typically qualify for coverage. Now, training is ongoing here. This is a bare minimum basic training webinar. Specific questions can be answered after this and ongoing. So here's basically the method or the process that we're going to go through today on how to do a test. First thing we're going to get is patient consent to verify their coverage. Okay. Then we're going to verify their coverage, and then we're going to go ahead and proceed through the application process, and then finally submit it. We're going to skip this one. This is how to swab. We'll talk about that in just a little bit here. All right. So the first thing that you'll need to do is consent, then we verify it, and then we apply. So all of you should have access to this website through the agent portal. We'll go through the agent portal in just a second here, but for now, let's just go ahead and get right to it. Portal pages is where you want to go. Patient enrollment. Remember, consent, verify, and then process. So to get consent, we go to that portal page, patient enrollment, and here we are, patient enrollment. Step 1, patient authorization and disclaimer. Here it is. You can read it to them if you'd like. They can listen to it while you're sitting there, or you can click this, and it summarizes the hot topics for them. All right? It's their choice to read it. Either way, at the end, you will sign, or they will sign rather, electronically. You fill out the form, your name, your rep number, your email, patient's name, phone number. You can see this right here. This is what we have to do, okay? Now, this is their consent. At this time, once they've consented to let us look at their coverage, you should have taken a picture of the front and back of their insurance card, the front and back of their driver's license. Okay, we're going to go back to this. After you've done the consent, you go and verify their insurance. And again, if you have access to the website, this is what you'll be doing. I want everybody here to pick P-Verify. You'll log in, agree to the conditions, and hit the login. It should send you a verification code the first time you do it. Okay, let me see what's going on here. All right. So once you get through it the first time, you'll go payer name, and I want you to type in MED for Medicare. Pick Medicare Part A and Part B. Leave everything alone. You'll put the Medicare number here, their first name, and last name. That's all you have to put in, and then you'll hit verify. Now when you hit verify, it won't list anything if I'm not on Medicare. If they are on Medicare and everything works out, they will go ahead and you'll get a big green check mark. Okay, it'll be big in the center of the page. After you verify their coverage, you click Active Medicare, no HMO. Next thing you're going to do is the CGX and PGX form. Let me go back and repeat that. You're going to click, BioConfirm. It says please use a wet swab for CGX and a dry swab for PGX. Teladoc. Now you're going to go ahead and fill out the form. Just read this to them. I want to check with you to make sure you haven't already done an in-home or an at-home saliva test that was paid for by an insurance company. Okay, no, I have not. Since you haven't completed the test, and so you go through here. It's going to ask you if they have a personal history of cancer. Say yes. I'm sorry to hear that. What was it? You go through this form. You just keep going through it. Okay? We're not going to go all the way through it for this little webinar, but just know this, that as you go through, you ask the questions. Maybe we'll go through it, I guess. As you can see, we're just going to keep asking the questions. So we're going to assume this person has a family history of cancer with their parents. Does mother or father have cancer? Mother and father, or actually we'll go both. What type of cancers did he or she have? Well, mom had ovarian. Dad had prostate. We're going to go with 50. This one here needs to be yes. Put in a phone number. date of birth, email address, mailing address, keep going through it. You'll put in the Medicare coverage, the number. Here's some medical questions that you ask them. Answer the racial questions. Ask them if they're adopted. Just keep going through this. And so basically, you just click the blocks that are appropriate, and at the end, I'm just picking them up. Yes, they qualify. Verbal consent provided. Your name, your notes, lab selector. You put bioconfirm, and then submit. That's it. Fast and Furious, one-on-one training is definitely going to be required. I want you to see the forms and how you do them. Okay? Then you have to submit patient's information and hit submit. From here, it goes right to the doctors, and they will approve or disapprove the test request based on what you put here. Okay, so now you've done the test. As far as the questions go. Now you need to swab the patient. Okay, now patients, and this is going to be for dry or for wet swabs. I'm going to go ahead and run this video real quick. It's very important that they do not drink or eat anything for 30 minutes prior to the swabbing. And they do not want to touch their tongue or teeth with the swab. This is the wet swab. It's for the CGX. Now, there's going to be a swab required for both tests. One for the PGX, one for the CGX. They don't want to eat or drink for 30 minutes prior. For the wet swab, you're going to open the package. You should have gloves on at this point. You're going to hand them the swab. They're going to stick it on both sides of their mouth for at least 10 seconds on each side. They want to rub the fatty part of their cheek, not touching their teeth or their tongue. If they touch your teeth or their tongue, you may get it rejected based on contamination. You do it on both sides. Once they hand it back to you, you unscrew it without touching the applicator. Flip it upside down. Screw it tight. And shake it for about 15 seconds. Now this fluid in there is actually drying the DNA. Okay? This is for the wet swab. The dry swab is very similar with the exception of there's no liquid to shake it. Okay? And the container it's not threaded, it just pops into place. The screws on the wet one, the white one just pops off. All right? When you get your swabs in the mail, we'll talk about it if you need it. Once you've swabbed for the CGX and the PGX, you're going to label the tube. The tube will be labeled with the first initial and last name and date of birth. Then you're going to there's a label that comes with your swabs to put on the bag, and you'll put the label on the bag, label it accordingly, follow the directions, and then put the samples in the bag. So you'll be receiving postage to get the swabs to the lab. Okay? So basically what I want you to do is this, let's say you swab somebody on a Monday, you'll be sending those swabs out on a Wednesday or a Thursday. Okay? Everything you've done up until Monday will be sent in on a Wednesday or Thursday. You're going to send in one package a week. But before you ship them off, you'll get the postage. Like I said, we're going to go into what's included in the package. The swabs are labeled, the bag is labeled, and then you'll get a swab packing slip off of the agent portal, which we're going to go into now. And basically you'll go to AMT website, you go to More, Agent Portal, swab packing slip. You fill it in right online, your name, your ID number. The tracking number will be on the postage provided label that we get to you. The total number of swabs in the package, first initial and last name, their date of birth, and what tests each tube is. So if you've got a CGX and a PGX for John Smith, John Smith, John Smith, same thing here, date of birth, PGX and CGX. You will do that for every swab in the container. Okay? You print that out as a hard copy that goes in the box or the envelope. You can use a padded envelope, you can use whatever you want. This gets printed out in hard copy and also as a PDF. You're going to need that PDF because the next thing you're going to do before you send that container off, the package rather, you're going to do production reports. And the production report is self-explanatory. So now here, you'll do the same thing. Patient first name, last name, and what the test was. If you have a PGX and a CGX for the same patient, you can put that in as a combo. You don't have to duplicate here. You'll do that for all of the people that you've swabbed. Then you'll upload a copy of that PDF with the production report that you printed with your swab packing label. Here's the process time frame. You're going to pre-qualify the patient. You're going to qualify them, submit the application like was shown on the website. Your application goes to the doctor, and QC reviews it, and then we get the doctor approval. You'll get it via email. That's when you're going to ship your swabs. You'll ship off the package with the swabs to the lab, and then you'll get paid. So pay time frames are this. If you swab somebody today, it'll be about 30 days before you see the pay for that. Okay? Estimated turnaround time is 30 days. Now we also have a retail side. So let's talk about that, no cost versus retail. On the website, which we'll show you in a couple minutes, we have several tests available that are direct consumer that do not involve insurance or doctors. Here's a little pros and cons versus the two types of tests that we offer at AMT. Number one, no-cost tests involve insurance companies and physicians and take a long time to see compensation. I think 30 days is a long time. Retail is paid out of pocket by the patient. No physicians are needed to order the panels, and people can use their health savings accounts to pay for the retail tests. Compensation is very quick. No-cost tests require a physician to interpret the results. Retail patients are encouraged to seek a physician to interpret the results, but it's not required. No-cost tests are under a lot of scrutiny and have been connected to fraud. Allegations of fraud are out there, as you can see in the news. We're 100% compliant, nothing to worry about with us. But still, it's an objection that you have to overcome. None of our retail panels in the industry have been connected to the fraud allegation. No-cost test results often are entered into the patient's MIB, which is their permanent medical record. The retail tests are not, and they're guaranteed to go to the patient directly. The no-cost test results are designed to go to the patient directly, but if they're ordered by their physician, they may get a copy. and that will go in the medical record. Now, for insurance as it stands now, people cannot use the DNA results to underwrite their insurance policies, raise their rates, or drop them. No-cost tests are limited to a few tests. Right now the PGX and CGX and 3 or 4 more coming out like we said, but the retail tests have a wide variety of choices. No-cost test results can sometimes take up to 12 weeks to get them to the patient. Retail tests take 3 to 5 business days once the swab is received at the lab. No-cost tests require a complicated qualification process, as you can see, very confusing sometimes, which opens up HIPAA concerns, especially at events. Retail tests are simple, and no health questions are asked by the agent. Here's a sample of some of the direct-to-consumer tests or retail panels we have to offer. We have a retail version of the PGX, a retail version of the CGX. We have a diet and wellness panel, a diabetic predict panel, essential vitamins and minerals panel, foundation or methylation panel, chronic pain, men's health, women's health. You can read the list. It goes on and on and on. And in the website, there are training videos for these tests and marketing materials as well. It's simple to order the retail panels. Just go to our website and go to the store. We also have an option for people with retail panels and for the no-cost tests to actually purchase the supplements that are recommended in these tests from us directly. So we're going to go through a little website tour. AdvantageMedicalTesting.com. The home page changes periodically. Most important thing is our mission and vision statements. There's some video links here for the no-cost tests. On the home page, some frequently asked questions. Then we have our human DNA tests. We have our menu. Okay, that includes the no-cost and the retail panels and some pricing. We even offer animal DNA testing. Follow the links there. This will put you in directly by clicking DNA Test Store right to the online store. When you're with the patient, they want to order one of our tests once you've shown them. You have an agent code here. You put your agent code in here. That way you get credit for the sale. There's also a link to our supplements company. You can click on it at the bottom, read through it, or you can just click directly right here. Brings you right up to our supplements page. Contact us, careers, and what you'll be using mostly is the agent portal. This button right here gets you to the website that we were looking at earlier, your patient enrollment. This is for the old lab. This is for the old lab. This is for you to check your email, company calendar, and again, the packing slip, you'll need that, the production report link, downloads, team viewer. Highly recommend you download this. That way if you're in the field and you have issues, we can link up with your computer and help you out. Again, we do not use paper in any way, shape, or form with these patients at this time. So if you do not have internet access when you're with the patient, then you have to reschedule the appointment or get a hotspot on your phone or figure out internet, because you cannot submit any applications or consents without internet access. Slack, that's our unofficial communications page. You can go back to the agent portal main menu, and then here's some brochures. A lot of marketing collateral, documents that you can use, logos for business cards and signage, and then these will be removed here very shortly. Example reports for the retail tests, and agent training. There's production portal training, videos for nutrigenomics, and then our retail program overview. Watch that. And all of the retail panels that we have available have training videos on them. They get pretty in-depth. Some audio files for you to listen to for sales training. All right, so this is the agent initial training webinar. I'm going to go ahead and stop the recording, open up the phone lines for questions.